Welcome back to Wellworthy, where we break down this week's biggest news in chronic illness, health, and food access. This week, we're focusing on energy and how research, policy, and the food system all shape our ability to sustain it while living with chronic illness. This week brought a surge of attention to women's health. A $100 million initiative led by ICONIQ and Melinda French Gates and others promises to fund new women's health innovations. At the same time, researchers identified new gene discoveries for fibroids, and international guidance was released on how fibroids are diagnosed and treated. We also saw renewed focus on conditions like PCOS and endometriosis. But until they translate into better access and everyday care, people with these conditions are still left managing fatigue, pain, and everyday barriers largely on their own. This is the Policy Watch on the government shutdown, version 1, if the shutdown happens. As of today, the government has officially shut down. For people living with chronic illnesses, this isn't just politics. It has direct consequences. Tax credits for healthcare coverage are at risk of lapsing, which means higher costs for families already stretched thin. Community programs like Kansas City's local food aid initiative that ended earlier this year shows just how fragile these food access programs can be once funding dries up. A shutdown also stalls research programs and medical funding, delaying progress in the very areas that support better chronic illness care. In short, when the government shuts down, the cost of staying well goes up. Another set of studies reminded us how preventable risk factors continues to shape chronic illness outcomes. Research highlighted that heart attack, stroke, and heart failure remain strongly tied to poor diet, smoking, and inactivity. These are all preventable, but they persist because of systemic barriers and inequities in access. And globally, the US continues to lag in reducing chronic illness-related deaths. This reinforces the need for a stronger focus not just on treatment, but on prevention and the systemic supports that make prevention possible. Food, medications, and access. There's quite a few things going on this week. First up, GLP-1 medications are reshaping lots of things, not just people's appetites, but also how much people are spending on food. While some people see this as a benefit, others are raising questions on the long-term impact of nutritional quality and the sustainability of this for people, particularly those with chronic illnesses. On the other side of access, there are several programs that provided local nutrient-rich foods that are ending. The Kansas City Food Aid Program is one example of how a lot of these more community-centered food access programs are the first to go. And this leaves families with fewer options for energy-supporting meals. In other news, a major FDA update is on the horizon. Regulators are promoting tighter oversight of the GRAS process. That's the system companies use to declare food additives. GRAS stands for generally regarded as safe. Overall, this could definitely have powerful impacts in terms of tighter control over the types of additives that are allowed on our food. There are some other potential impacts as well. There could be higher compliance costs for companies, particularly smaller brands. This could also limit the innovation in functional products and ingredients, but also potential reformulation of old additives may come under review. On the flip side, this could definitely help to build stronger consumer trust and transparency in food safety. And if you're someone in particular who has a chronic illness, this really matters. Additives can influence inflammation, digestion, and energy in ways that science is still uncovering. Greater FDA oversight could mean safer food, less hidden risk, and more trust in what ends up on our plates. Just to level set though, the FDA's proposal is literally just that right now. It is a proposal. That means that there will be a public comment period before anything becomes final. For consumers, advocates, and patient communities, this is the moment for you to pay attention. Public comments are how everyday voices, not just people in the industry, can shape outcomes. Submitting feedback, even a short statement, signals that safety and transparency in food actually matter to people living with the everyday consequences of chronic illness. So what's next? The FDA will open the comment docket soon, and once it's posted, organizations and individuals can weigh in. Industry groups are likely to push back on higher costs, so patient and individual comments will matter. In other news to watch, 2 headlines particularly stood out this week. Cases of so-called nightmare bacteria are rising, raising alarms about antibiotic resistance. And new research on dose therapy shows potential relief for chronic illness patients. A reminder that innovations in pain management continue to move forward. This week's news highlights a truth that we often come back to. Energy isn't just about how much you eat or how often you rest. It is also shaped by research, policy, and by whether or not systems support or obstruct your care. Staying informed, advocating for yourself, and leaning on community are not just strategies, they are lifelines. That's all for this week's Wellworthy. As always, stay informed, stay grounded, and be well.